Hi, everybody. Thank you for coming to this seminar that is going to address carpal tunnel in our industry. Also looking at various treatment options, including the Eastern perspective. So I'm going to turn it over quickly to Patricia Richards, master mixologist, USBG legend, superstar. Also a recent graduate from the university. And she's going to introduce the rest of the team who's going to talk to us about this really kind of critical issue in our industry. So I'm going to turn it over to her and give her her hosting duties and mute myself. And I'm going to do that now. Here we go. Make host. There we go.
Well, hello there. My name is Patricia Richards. I've been a Las Vegas bartender. Next year will be 20 years. And I've been in the hospitality industry for 36 years now, as a cook, as a food server, as a bartender, as a property mixologist and management. So I've had this long and fruitful career because along the way, I've been interested in health and wellness and taking care of myself. And I've seen chiropractors, I've seen acupuncturists along the way. I've been working out, I've done yoga and stretching and all of those things and eating healthy. And I've been conscientious of my health. And that's what's brought me here today to have this long and fruitful career. Today, I'm at the Wongu University. I've decided to study Chinese medicine and I recently graduated. I'm about to do my 4 national board exams. And so there's a lot to learn in this field and I'm really excited. And I'm also excited to introduce you. I'm sitting here at the school at the Wongu University. I'm here with Dr. Lee. He's the president of the school. If you'd like to say hi, Dr. Lee. And if you'd like to have a seat here really quick and say a few things.
Very shortly. Good morning. I'm Dr. Lee, the president of the Wongu University. I appreciate the invitation for us, and I hope that we can be a little bit more closer to your community. Okay. Hope you enjoy the Dr. Wong's presentation. Thank you.
Thank you, Dr. Lee. And also know that the clinics here, you guys, the treatments are $60 for the first treatment. It's 2 hours long, and then follow-ups are $40. So it's a great affordable way for bartenders to receive treatment. And then later on, we're going to introduce Dr. Adrianus Wong, and he is going to discuss also he has a lot more experience, clinical experience, because he's been licensed. And so he has a lot to share with all of you as well. All right, so I think we'll go into screen sharing and my first part of the presentation. Let's see. All right, we can see that all right? Everything's good? All right, so we're here for the Carpal Tunnel seminar and creating awareness of carpal tunnel in our field and elsewhere. It is the most common nerve entrapment syndrome, and it does cause a lot of work absences because of the pain and numbness, et cetera, that people are feeling. What causes, and actually I have this young man over here with me. Introduce yourself.
Frank.
Frank is with me here from the USBG. We're going to do a little bit of one-on-one with him and a little show and tell, if you will. So basically what happens is we have a carpal tunnel and in our wrist, and it's the median nerve that runs along here. And you can get an entrapment of that. Repetitive use, there could be hereditary reasons, pregnancy, obesity. As women age, they're more prone to this issue. And like middle age, for example. And so what can happen is through work injury, like repetitive use, you can get micro tearing, and then adhesions can form and cause inflammation of the wrist flexor tendons. There's like 9 of them, and it can cause median nerve impingement. And from that impingement, we get pain, we get numbness, we get paresthesia, which is like a tingling sensation in the fingertips. We can have pain that runs along the arm all the way up to the shoulder, for example. And then we have a link here you can check out about possible self-diagnosis, but really that's not recommended because There could be other conditions that can mimic it, such as a pronator teres syndrome or cervical disc herniation in the C5 or C6 area of the neck. And then carpal tunnel syndrome is a progressive disorder. They call it incurable, actually. So think about diabetes. You know, you can't cure diabetes, but you can manage the symptoms. So that's basically what we're looking at here, is we're looking to manage the symptoms. And so basically you won't feel anything, or as little as possible. And so early detection, diagnosis, and treatment is key for managing symptoms. And if you have mild to moderate symptoms, there's a possibility of 100% recovery. But if you let it go too far along, even surgery may not help you. So you have to be really aware of that. And you can have tired hands or tendinitis, but with what stands out with CTS is that you'll get this prickling numbness sensation even while you're sleeping. It can actually wake you up and you have to like shake your hands out to like, you know, to go back to sleep. You might have to wake up a few times to get rid of that sensation. And the sensations may frequently, see the diagram here, they'll begin, you'll see more on the index. We have the index, middle, and the thumb side of the ring finger. So these fingers here will be affected, but not the pinky. So that's a sure sign as well. You will not have pinky involvement. And then we have 3 stages of severity. You're going to have mild, moderate, and severe. So really you want to capture it between the mild and moderate stages. And mild, you might not even feel anything actually. But you're going to have 1 or more of these following symptoms, whether it's pain, like I mentioned, that goes all the way up to, could go up to the shoulder, doesn't have to. The pins and needles feeling, you might have puffy feeling, soreness, itching, shooting electric shock, weakness, like even turning a doorknob becomes an issue, and some stiffness, things like that. And you'll see this questionnaire over here. This is an important questionnaire that you might want to look at on your own regarding if you have carpal tunnel or not. It's a Levine questionnaire. So the moderate stages, it's going to get a little bit worse. So not only at night or at rest are you going to have the symptoms, but you're going to also have them during the daylight hours. So it's going to get progressively worse. And you're going to have a loss of hot or cold sensation in your fingertips. You're going to have more intense numbness and tingling, and a real loss of the grip strength. And then in the severe stage, you're going to have 2 or more symptoms of those previous symptoms present simultaneously. You're not going to be able to do the fine dexterity movements at all. You're not going to be able to do something like this, you know, those kind of things. And then thenar eminence, this is the area right in here of the thumb, this protruding puffy part. You're not going to be able, on one side that doesn't have it will feel normal, and then the other side you might have an indentation right in here. So you're going to have thenar muscle atrophy and severe loss of temperature sensation. So some of the Western treatments that are often used will be corticosteroid injections. So steroids are produced by the adrenal glands that sit on top of our kidneys, so the small adrenals, and they produce steroids. But so they inject steroids directly. You can see into this diagram here, they inject directly into the area, and it helps to reduce inflammation and swelling, and reduces pressure on the median nerve. And it can provide short-term relief, but only in about 45 out of 100 patients. So it doesn't help everyone, it's less than half, right? And so the cons are the possible side effects, because whenever you're using a drug, even pharmaceuticals, you're gonna have side effects. And so you have to be aware of that. You have perhaps some tendon weakening and degeneration, steroid-induced osteoporosis, possible infection, tendon scarring, tearing or rupture, injury to the median nerve during injection if they don't do it right, and injection site pain, things like that. And it only provides temporary relief. So each person is different. And so the temporary relief may last up to a few months. But again, you're gonna, you know, this could be cost prohibitive and over the long term, because if it'll be cheaper if you go to the doctor's office to get them, but if you go to like a surgery center or a hospital, it's gonna be at least 3 times more expensive. And so over the time, not only you might be damaging certain components of your body, but you also may be cost prohibitive. So For the short term, it could be good. It could delay your surgery. If you're not ready to go into surgery yet, you're saving some money or whatever it is. But for the long term, it is cost prohibitive and you don't want to rely on that. So for those who are aware, you might want to look away if you don't want to see the surgery photos here. But there's a common surgery the Western folks use, and there's about over 350,000 performed every year. And it's called the carpal tunnel release surgery. And you have the two types of surgeries. You have the open and the endoscopic. Endoscopic looks a little bit less invasive as far as, the scar is smaller. Pros of the surgery is they cut the transverse carpal ligaments, and it helps to relieve swelling and pressure in the median nerve. And then what happens is scar tissue will form in here. They cut it and then scar tissue forms. So then you have more space in this area. And so then with the more space, you're going to have less pain overall once you're healing, of course, post-surgery. And then patients had less post-operative pain using endoscopic versus the open technique. Some of the cons, however, is that 50% of patients after 2 years were not satisfied with the surgery. And they said the pain returned or some symptoms from previous had returned, numbness, et cetera. And so, if you're thinking 50% of people were not happy with that, it's probably not the best way to go. It is an alternative, but I think that we can look at, other alternatives as well. They also reported a decrease in strength, and the occupational cases were slower to improve and remained off work for a longer period of time. So that's something to be aware of for your budget if you have to go in for surgery, and how long are you going to be off work, and are your bills going to get paid, that sort of thing. And then additional carpal tunnel treatments that actually Eastern and Western share. Western calls it myofascial release, and then Eastern calls it Tui Na. And so it is commonly used. It's a hands-on therapy, and it is applied to the skin of the affected area where the practitioner works the fascia in opposing directions. Okay, working the fascia in opposing directions, kind of a dough kneading effect. All right. And this is breaking up the adhesions, and it loosens restrictions in the fascia. If you think of fascia, think of the inside of the pomegranate fruit. If you cut a pomegranate fruit and you see all the seeds, well, what's connecting the seeds? That's the connective tissue, that's the fascia. And by breaking up the adhesions and loosening the restrictions in the fascia, you're going to reduce the inflammation and swelling, and you're going to help with the pain management. This is also considered a non-invasive therapy. So surgery is pretty invasive. So we want to, use that as like the last resort, so to speak. You don't want to go for that as your first resort. And especially if you let the pain go too far, too severe, surgery may not even help you. Whoops, what happened there? And so it also drains. When you do this myofascial release or Tui Na, it encourages blood flow. For us, the qi and the blood flow together. So we want the energy and the blood flowing. So we look for that in our medicine. And then it helps drain excess pressurized fluid from the wrist joint. And it is also recommended by the American Osteopathic Association. The con of it, however, is that they're saying the frequency of treatment for efficacy, you want to go like once a day for 15 minutes up to a month. So that takes some commitment, and not everyone is that committed. And so there's that to be conscious of. And then from the TCM treatment example, in TCM, we look at, we do pulse diagnosis, we do tongue diagnosis, we take your histology, and then we come up with a diagnosis and then a treatment strategy. So we have various things that we use in our tool basket. For example, we use herbs and we use acupuncture. Part of the acupuncture is electrostimulation. That you could see a picture of here, where we're using some electricity to connect 2 points to stimulate a current. And so if someone's paralyzed, we'll stimulate a more aggressive current, for example. And then our herbal therapy. So think in our bartender's field, we use all kinds of herbs too. We have herbs in our gin, so it's vodka plus botanicals. We have Campari and Aperol. So those are aperitivos to stimulate salivation before we eat, right? 30 minutes later, you're hungry. And then we have things like amaros, like Fernet Branca or Amaro Anino, because we want to have those post-food, post-dinner to help digest our food. Okay, so in the liquor industry, we use herbs, and in Chinese medicine, we use herbs. And in this case, we're looking at, Wu Jia Pi is helps with the cold damp, and we're looking at Job's ears, we're looking at draining dampness. Xuan Shang, we're looking at doing some moving, and Dongwei for more tonifying, Bai Shao for more tonifying. So this is the person we're looking at, an issue with this is where the pericardium channel moves in our medicine. Okay, we're in our fascia is the premovascular system where all the meridians are and channels, and helps with the movement of energy, and the blood and the energy moves together. So we have in this pericardium channel, we might have a blockage in here. It could be due to spleen qi deficiency, some exterior conditions such as wind, cold, damp, blocking the channels, things like that. Wind, cold, damp, blocking the channel. So this is like the pericardium channel right here, okay? And then we have the lung channel going through here, and different channels. We have the heart channel going through here, okay? So it's very fascinating medicine. And in this case, we learn about all these hundreds of herbs and how we put them together in herbal formulas in a perfect symphony, just like the liquors and the amaros and the digestivos and the aperitivos, gins, things like that the liquor industry uses. We kind of, in a parallel universe, if you will, do that with herbal formulas. And then as far as acupuncture, we have the Ba Xie points, which are located in here. So we might do some acupuncture and electrostimulation and hook up an electrode. It looks like here, this is a slide from one of my previous professors, Dr. Chu, and this is one example of a carpal tunnel syndrome treatment. There's so many, because in the art and science of Chinese medicine, it is a science. There's a lot of studies on it. You can go to PubMed.com, you can look for yourself, but there's also an art to it. So not one size, one shoe fits all. Not one medication suits every patient. Every patient is an individualized medicine, and every patient is different. And so we might, treat these Ba Xie points. We have a triple energizer, Sanjiao. We have the pericardium 6 point between the tendons here. We have the triple energizer 5 point right about here. So these are some, and then what would be a great local point to treat carpal tunnel would be this pericardium 7, because that's the median nerve right there. So you could see here, he has moxa. So moxa is an herb that we burn, and it's mugwort, also known as Artemisia vulgaris. And we might burn that right over about an inch. We don't want to burn the patient, but we might hold that herb about an inch over this point. And so we have this local Ashi point. This local Ashi point right here. Ashi means a local. And so, and then we might want to palpate on a patient too, where it's tender. So that's another way we discern Ashi points or not, is some tender points. And so we might burn this herb. We have different types of moxibustion that we use, but one is a stick form, and I might hold it above this point here for about, until and the patient will tell me when it's too warm, and then I'll move to another point and then go back and forth for about 15 minutes, okay? And so that's one treatment here that we use. We have electrostim. So we might use that on a couple of points, like the Ba Xie and this triple energizer 5 or the pericardium 6 point, to stimulate some movement in there, some qi and blood, get rid of the stasis and the stagnation, and move the fresh qi and the blood into the area, okay? So we look at local points to treat, and then we also look at constitutional points. What's going on with that patient? Do they have excess dampness? Do they have a deficiency? Oftentimes we have both deficiency and excess patterns that we have to treat simultaneously in the patient. So what is the priority? And so we'll do some constitutional body points, and then we'll do some local points. And that's kind of how we look at it from a Chinese medicine perspective. It's an art, both an art and a science. All right, and so some TCM, traditional Chinese medicine treatment pros. It's less invasive than surgery. You're gonna have little to no downtime or recovery time. Some of our patients be like, oh, you know, I was so relaxed that I took a 3-hour nap after I left your office. And, you know, that's cool. You know, that's very little downtime. That feels great, right? To have a nice afternoon nap because you're feeling so relaxed. It works to restore the body's natural healing abilities, utilizing various techniques such as the acupuncture, cupping, moxibustion, tuina, gua sha, herbs. And then we use the herbs, which are more gentle to the system, more like a food versus intense toxic chemicals with 8 side effects like pharmaceuticals. And then let's face it, acupuncture releases your own body's natural chemicals like endorphins, dopamine, serotonin, and so you feel great afterwards. And so some of the cons here is that a practitioner may not accept insurance, so you have to pay cash. They may require you to adhere to an herbal formula that you have to take at certain times of the day, and some people just want a quick pill in their life and keep going. Well, that's not dealing with the root cause of your problem. You're dealing with the branch. If you do a painkiller, keep going, ignore it. That's dealing with the branch. That's not dealing with the root problem. We like to deal with the root problem. We get to the root, the constitutional problem of what's going on. And then you may have to go for several times. If that problem's been there for a while, guess what? It's probably not going to go away overnight. And so you may be required to come in twice a week for 2 or 3 weeks, and then phase down to once a week after that, and then, you know, go into more of a maintenance phase, once every 2 weeks, eventually once a month, just for maintenance. So these are things that take commitment and more of a time commitment. And so are you willing to do that for your optimal health? You know, these are things that you have to ask yourself. All right. I think I've covered it all for my section. I would like to now introduce, that was a lot, right? That was good?
That was excellent.
Yeah, awesome. So we are going to introduce, thanks for being my guinea pig over here, Francis, thank you. And so next we're going to introduce Dr. Adrianus Wong. He is, and I'm going to upload his file here. Let's see. He is both he received his medical doctorate degree from Trisakti University in Jakarta, Indonesia, and he's a licensed acupuncturist in the state of California. He's also one of our professors and teachers here at the Wongu University here in Las Vegas. And he has his DAOM from Dongguk University in Los Angeles. And he is also a nationally certified diplomat of Oriental Medicine, NCCAOM. And so I would like to welcome, hopefully I don't have technical difficulties, but we will go from there. I will load his escape, close that out. All right. And we will upload his presentation and he will take over. And I need to mute myself, no? Oh, it doesn't matter? Okay. Yeah, I mean, that PDF is that I uploaded is available. There's links on there. So there's additional links for everyone to check out on your own time. And then that questionnaire is on there as well as part of the slide. If you need me to submit it separately as a link, I can do that. Okay. And print as they wish. Okay, so that's another option. So are we able to hear Dr. Wong now, or do I need to mute myself, or what's the next thing I have to do here?
Can you help me share the screen, Patricia, the slides?
Yeah, I have it on mine, and I'm pretty sure I shared the screen still.
Thank you.
I thought I shared my screen. Am I not sharing my screen still? Yeah, you're muted. Yeah, he's still muted. I should mute myself, no?
Okay, thank you everyone. It's nice to meet everyone. So I'm just gonna share a little bit, continuing the information related to the carpal tunnel syndrome. Next slides, please. So pretty much what we're gonna cover, like we're gonna review a little bit what is carpal tunnel syndrome and what some sort of the referrals, the exercise tips and the modalities that we use to treat for this carpal tunnel syndrome, and also introduce a little bit to what is traditional medicines or what is acupuncture and its mechanisms, as well. We look at the evidence of how this treatment is evidently is working for this carpal tunnel syndrome. Next slide, please. So one of the important thing with the carpal tunnel syndrome, it's really a condition where the median nerve, which is the central nerve in the wrist area here, that got compressed. So how it got compressed, any conditions, any risk factors that actually triggering the area around this wrist in here that finally compressing of our structure of our median nerve, and that will lead into this condition, what we call as a carpal tunnel syndrome. And the reasons why it's called carpal tunnel and it's syndrome, which means actually it's a collections of the complaints, the conditions surrounding around our wrist, and the tunnel simply means that the nerve is passed through a certain area, a narrowing area, which is covered by the complex structure of our bone and also with our connective tissue. It's some sort of like a sieve that covering our tendons. And that sieve is actually the problem where it's actually get inflamed over the time due to our risk factors that leading to the injury of the local structures, and therefore creating that inflammations to that tendon sieve. That sieve, we call it as a pulley, and that's why that sieve, the inflame of that sieve, creating this swelling and compressing to that median nerve. And due to that compressing to that median nerves, and that leads to the sort of a complaint like pain, numbness, tingling, and in some or worse scenario, it can also lead to like reduce of the motoric functions, and also even leads to the reduce of the quality of life of the persons. Next slides, please. So if you look at in here, one of the important thing that we can see is that the center part around the wrist, if you can see that there's like a white structure in there that covering the nerve, which is the yellow part that's around down in the center of our wrist, that's the tendency that actually get inflamed due to the risk factors, due to the workforce, due to the anatomical structure, or even in some conditions that if the person is like having a perimenopause, obesity, pregnancies, these sort of conditions can also lead to the increase of the body fluids change, and also can have a risk that increasing this swelling, and that swelling creating these inflammations and pressing this tendency into that median nerve. Next slide, please. So when we look at into more detail again, then you look at that right in the wrist center like that, that's the tendencies, the pulley that actually covering this median nerve. And the purpose of these tendencies is actually for the smooth movement, the mobility of our wrist, and also to control the agility or the purpose or this kind of like the movement of our finger. But over the time, due to the inflammations within that sieve, which is running through that tunnel in our wrist, and that's kind of like compressing which already a narrow space for our median nerve. And that compressing to that median nerve is obviously is very specific. It's caused the numbness to especially to our three fingers, our thumb, our index, and our middle finger, and half part of our fourth fingers. Next slide, please. And one of the common things, like if you have a lot of movement with the wrist, and especially if you're like a biker like that, when we have this force of these flexions to our wrist, and that's obviously increasing this triggering to that injury over that tendency. And as you can see, like when injury to that tendency, and that's further triggering the compressions to that nerve. Next slide, please. So we talked about this already. The risk factors, the workplace factors is one of the most important risk factors for the carpal tunnel syndromes. The anatomic factors, some folks who have this leading the process into the degeneration of the bone structures, like in the arthritis, that can also leading to the inflammations to that tendency due to the overstress from that bone spur that degenerated from the structure of our bone, that damaging the structure of that tendency. The nerve damaging conditions, such as conditions like diabetes, also can lead to the change of the structures of the nerve and creating these inflammations as well to the nerve conditions. Inflammatory conditions like rheumatoid arthritis, obesity, body fluids change like in perimenopausal pregnancies, and all of these may play a risk factors for carpal tunnel syndrome. Next slide, please. So this is what we call as a vicious cycle of the carpal tunnel syndrome due to that inflammations or the injury to that tendency that leads to what the condition what we call as an ischemia, which is a condition that lack of oxygenations in our wrist tissue, in our tendency, and that ischemia or that lack of oxygenations further leading to the damage to our nerve structures and to our microvascular structure, and damaging to that structures leading to the leakage to that surrounding fluids. We call that as an edema, and edema over the time will be repaired by our own body, but that repair is not really like fully recover, and therefore it will cause a scar tissue of fibrosis, and that scar tissue, which is lack of the functions or the mobility, will further increase this pressure to the carpal tunnel syndrome and leads back again to the initial process of ischemia and inflammation, and therefore the cycle will keep continue. And that's what's leading into this chronic persistent pain and also this numbness or paresthesia in the fingers. Next slide, please. And therefore, over time, obviously damaging to that tendency and compressing to that nerve will disrupt the nerve signals, which is carried that informations by our nervous systems, including in that median nerve. Next slides, please. And therefore, our main clinical symptoms for carpal tunnel syndromes are numbness, tingling, especially in that 3 digits finger, and then vague aching, especially that radiates to our tummy area, the tenor, and also feeling the aching, and also in some worse scenario when it leads to the involving to our motoric functions, our muscle functions, and therefore persons can develop the weakness as well in moving the finger, as we see before that the tendon that running from our wrist is actually going to all our 5 fingers, and therefore this wrist here is actually our maneuver not only to move the wrist but also to move our hand, our fingers, and compressing on that median nerve in that center in there, that will lead to the weakness of controlling our muscle or hands, and therefore a person can feel like weak, dropping the objects, cannot open jars, or twisting of the lids, for example. Next slide, please. So one of the quick tests that we can do this physical exam, we call this alumn test, and you can simply like doing this by yourself like this, and flexing up of our wrist like this, and doing this slightly compressing like that, and therefore we're forcing these compressions to that nerve to elicit that pain. If you have this prone to the carpal tunnel syndrome, and this tends to elicit a certain discomfort and pain and tingling to the affected fingers and the hand. The other test that we can also do is a simply tapping test, or the Tino sign, where we actually tapping directly to the structure of that median nerve. And if you have that compression to that median nerve, and obviously tapping on that area will induce this tingling, numbness, and sometimes in the worst case, it can also cause this kind of like electrical sharp pain sensations over the fingers. Next slide, please. So the treatment we already looked at before in the previous presentations, the various non-surgical treatment from re-splinting medications, corticosteroids, and also to the several types of the surgery. But we also want to look at in here more specifically with the treatment pertaining to the acupuncture and traditional medicines. Next slide, please. One of the important things as well that when we offer the non-pharmacological treatment, the non-surgical treatment, to the patient is that when we don't see any progress or failing with the non-surgical treatment over 3 months, then that's one of the indication that we need to consult to the orthopedics for further evaluations. And also one of the conditions like patients keep having this persistent numbness, weakness, atrophy, or the wasting or the reduced volume of the muscles, then that's prone us to that we have to refer the patients to the orthopedics. Next slides, please. So one of the things that we can do at home, day to day, even at work, if you have this carpal tunnel syndrome, or if you want to prevent the carpal tunnel syndrome, then you can do this simple two exercise. We call it nerve gliding and tendon gliding. The purpose of nerve gliding is really to open up that space, that carpal tunnel space, to reduce the compressions to the nerve. So what we did with the nerve gliding, it's simply that you make a fist like this and slowly open up your hand and then push back. And when you push back like this, you touch your thumb and you push it further to the back. And this simple maneuver like this is actually forcing the opening of this carpal tunnel and therefore reducing the compressions to that median nerve. So the nerve gliding is really a simple exercise where it's helping to reduce the compressions and reducing the pain. Tendon gliding has a slightly different purpose. Tendon gliding is really to train to increase the mobility of your finger and also the muscle in our elbow, because the whole movement of here will support our wrist. So for doing this tendon gliding, if you can follow with me, then first you open up your hand like this and you simply make a wrist and then open up again and slightly moving it to the front and then making a wrist and return back again to the normal positions. So it's really like training again the mobility of this wrist movement. So you do this alternatively, nerve gliding, tendon gliding, and then we did this like 2 to 3 times per day, and each time it's about 10 to 15 repetitions, and we can do this every day for about 3 to 4 weeks. But you can also do this as well during the work. Let's say that you spend let's spend about 2 to 3 minutes or 5 minutes at least before every hour of the works, and that should be really helping a lot for this small structure here in the wrist. And it's really just only take about 5 minutes in every hour to step aside a little bit, do our own exercise with our wrists, and before we continue again to the work. Next slide, please. So talking about the acupuncture, we saw that before that acupuncture is really a great modality that was used in traditional medicines by putting a small, very thin needle on the certain points on the body. And also we can include that as well with the stimulations using these electric vibrations, which is actually very non-invasive and very smooth and very gentle, no pain at all. But this triggering of this needling actually has a lot of mechanism. It's a lot of interesting finding that we can see that actually it's helping reducing that inflammations, especially to that ischemia conditions that we see is one of the culprit in this compression of this median nerve in the carpal tunnel syndrome. Next slide, please. So acupuncture is a part of the traditional medicines. And what is traditional medicines? One of the important take message in here with the traditional medicine is really that the medicines that offering the treatment, not just focusing on the disease, but the medicines actually more focusing on treating how is the person's will relates to that disease. And therefore, for Chinese medicines practitioners, they're not really just focusing on that pain in that wrist, which obviously is a chief complaint and we have to address in that. But a part of the treatment also will see like how do these patients will relate to that disease and how is it more fit individually to that patients in dealing with that carpal tunnel syndrome, in dealing with that pain. And therefore the treatment between one person to another person will be different. Some persons who have more constitutions weaker, then the treatment will be more focusing to also uplift more of his energy, of his nutrition. But some persons who is more excessive, who is more pain, more swelling, but not really that fatigue, and we do more treatment, like more draining, increasing more of the circulations, and therefore it's more suitable, specific to the persons. And for chronic treatment like this, long-term treatment like this, actually this type of treatment is really best because it's suited to the specific persons rather than making a generalizations of the treatment for the same conditions. Next slide, please. So modalities that is included traditional medicines that we see before, acupuncture, moxibustion, herbs, and so on. Acupuncture, I think acupuncture and moxibustions and electrostimulations are really the important part in treating these carpal tunnel syndromes. Herbs medications are also really an interesting modalities as well that can also help treating the conditions to the internally rather than directly the interventions into the wrist. Next slide, please. So what we see in here is that what is the difference between traditional medicines and the conventional biomedicines. With the conventional biomedicines, obviously we make a diagnosis to the certain type, certain name of the disease. Let's say the person's having this GERD or like a reflux disease. And the principle in the Western medicine is that we look at into specific things that causing this reflux, that's causing this gastritis or causing this carpal tunnel syndrome, which leads us to, and we found like in the anatomical thing, we found, okay, there's an ulcer in this person and therefore we have to address this ulcer. And we were hoping that the gastritis will be reduced. But in Chinese medicines, the diagnosis of that GERD and that peptic ulcers is not the final point. Even though we know that is the diagnosis, we still have to look at individually to the persons. How do these persons A, person B, person C will have a specific relationship to that disease? That's what we call as a diagnosis pattern in traditional medicines. Different pattern will lead us to how do we put our needle differently, how we provide herbs differently, and how we approach the patients differently. Next slide, please. And that's the complexity, and I will also say the beauty of these traditional medicines. This recognizing this pattern will actually require the practitioner to not just focus on the physical or not focusing on a certain disease, but actually they have to understand their patients through observations, listening, smelling, questioning, and so on. Next, please. In a study, we actually found this, and we actually see that in one name of the disease in Western medicines, when we're actually using the AI and looking up what is the possible pattern according to the diagnosis in traditional medicines, as you can see in here in one of these publications, one diagnosis like diabetes can pop up like 7 different diagnoses in traditional medicines, which leads to the different 7 types of the treatments or approach to the patients. Next slide, please. And therefore, the complexity in knowing the traditional medicine diagnosis is actually where the treatment is underlying with. You can see here like diabetes, heart failure in the diagnosis in the conventional medicines, but when you go to the Chinese practitioners, then they still have to do the second diagnosis, which actually finding the correct pattern of the patients themselves in relating to that disease, that leading into this diagnosis pattern like phlegm deafness, dual deficiency, blood stasis, and so on. Next slide, please. So this system thinking or individualized medicines or patient-centered care model is really the core essence of traditional medicines. And next slide, please. And actually, WHO has recognized this, and in 2019, there's a complete revisions to our International Classification Diagnosis Code, ICD code, which is a specific code that every practitioner should have and should coding as soon as we diagnose the persons, before we selecting the treatment modalities, the treatment modalities will have to rely and we have to relate into this diagnosis code. The diagnosis code currently is using the ICD code version 10, but the world already moved on and already do these revisions, and it's already moving into the ICD-11. In ICD-11, one of the revisions that we see is that it includes the specific diagnosis code, or we call that independent diagnosis code, specifically for the TCM diagnosis pattern. Next slide, please. And therefore, you actually see like the coding using the pattern in the world of traditional medicine, like liver yin deficiency, liver yang deficiency, and so on, which actually has their world diagnosis code. And that's actually one of the a great achievement, where this recognition of these traditional medicines and their diagnosis in the worldwide base, and the implementations of these medicines. Next slide, please. So going back again to the mechanisms of the acupuncture, acupuncture actually has 3 steps of the mechanisms. As soon as we put the needle on the person's body, it does already the effect to the local tissue, to the local connective tissue. As we see before, more of that blood circulations. And then on the segmental level, which is on the spinal cord level, it actually leads to the modulations of the pain. And then therefore in the central level, which is mostly in our central nervous systems, in our brain, one of the important things I would like to mention in here, that it leads to the influence on the periaqueductal gray, or PAG, which is an important structure in our brain stem, a part of our back of our brain here, that actually is a center for the productions of this endogenous opioid, which is our natural opioid like endorphin and enkephalin, to combat the pain and to also increase the smooth movement, the contractions, relaxations of the muscles. So next slide, please. So as we know before that during the inflammations, where it leads to that addition, which is actually what happened with the carpal tunnel syndrome patients, that the main thing that happened in there is the lack of oxygenations. Because of the lack of oxygenations, which what we call as an ischemia, that leads to the reduced productions of the body energy, or we call that as an ATP. And the body actually requires ATP to do their normal physiological functions, to do their metabolisms, to do their activity. But due to that reducing number of that ATP, that's why it leads to that inflammations, swelling, and leading into that carpal tunnel syndrome signs and symptoms. But one of the study that we that was published and that they did in New York, we found that with the needling, with the acupuncture, and it takes like until 30 minutes, where the ADP, ATP, all these markers are all increased because of the retaining of that needle. But when we retain the needle until 30 minutes, and that's where the level of the ATP starts to decrease. And I think this gives some of the reasons why the acupuncturist, typically when you go to the acupuncture, they put a needle on your body and then they actually have to leave your needle for a certain time, like 20 minutes or 30 minutes. So we found that on the study that actually acupuncturists are needling on that point, it leads to the increased productions of this ATP, which give us some promise that how it can help in reducing these inflammations. Next slide, please. And we also see this too, the production of this ATP is really like what we also see it as well when the person is doing these mechanical stimulations or electrical stimulation, or even in performing the heat stimulations. Next slide, please. And one of the next step of the study with the acupuncture is that the involvement of what we call as a functional MRI, where actually we can study, learn directly the function of the physiological, what's happening in the brain during that acupuncture. So the person is actually was given the acupuncture, and then they were scanning with the functional MRI, and we can see the brain activity, and we can see like which area in our brain that is actually active, and that's helping us further explaining the mechanisms of the acupuncture in the relationship to the treatment. Next slide, please. So this is, I think, one of the great study and great finding in what they did in Boston, in Massachusetts, that we have these two groups. One group is actually the carpal tunnel syndrome patients, and then the other one is the healthy patients. And what they did in here is that prior to the scanning and prior to the treatment, in the carpal tunnel syndrome patients, they were scanned with the functional MRI, and they're focusing on the scanning on the sensory stimulus in the sensory area in the brain that responding to the digit 2, digit 3, and digit 5. And we see before that median nerve actually affect our thumb, our index, and our middle finger. And therefore, that's actually a really great methodology in here that they actually want to focus on the digit 2 and 3, which based on the theory that we know that these two digits should be the one that has the problem in the carpal tunnel syndrome patient. And then for the period of 5 weeks, these patients will receive about 13 treatments of acupuncture, and then 5 weeks later, they will be scanned again with the functional MRI. In the healthy group, it's the same. In the baseline, they do the functional MRI, so we can compare on the prior to the treatment, what is different in the brain activity between the carpal tunnel syndrome patients and the healthy persons. And then in the healthy group, after 5 weeks, they also will be scanned again with the functional MRI. Next slide, please. These are several points that they perform in this study, and we look at before in the previous presentations. Patricia actually explaining to us that one of the important point is needling on this pericardium 7, which is the center of our wrist where this median nerve structure is located. Next slide, please. Now, one of the finding in here that we can compare that on the left side, you see the image of the brain activity prior to the acupuncture treatment in the carpal tunnel syndrome patients. And on the right side here is the scanning results after 5 weeks of the acupuncture treatment. And you can see here the brain projections activity on the digit number 2, digit 3, and digit 5. And we can already assume that prior to this testing, that digit 2 and 3 should be the affected digits should the patient have this carpal tunnel syndrome due to the problem in that median nerve. So in this scanning, they're looking at a specific area, which is the sensory motor area in the brain, which is responsible for interpreting the sensations, the feeling of the pain, and the movement of that digit 2 and digit 3. And we see here, prior to the acupuncture, there's a lot of activity in the digit 2 and 3 within the brain. And that's maybe explaining to us why do the patients having this chronic pain and also having this weakness and tingling, numbness, and sort of these signs and symptoms with the finger in the carpal tunnel syndromes. And after the acupunctures, especially in this digit 3 area here, that actually that area become more calming compared to this baseline of 5 weeks before they receive this acupuncture. Next slide, please. And what they also comparing in here between the healthy patient, the left side in here, and then the right side where you see the brain activity on the carpal tunnel patients. In the baseline prior to the treatment, in a healthy patient, you can clearly see the separation of the 3 digits, 2, 3, and 5, that 3 dots in there. That's nicely separated, meaning that there's a nice separations and the movement of the fingers, the digit 2, 3, and 5 in the healthy persons. But when we look at that in the carpal tunnel syndrome patients, prior to the treatment, the digit 2 and 3 is kind of like jamming together. And that's maybe suggesting something pathological, its presence due to that median nerve. And obviously, after 5 weeks in the healthy patients, the 3 digits still separated. But what happened with the acupuncture? After this 5 weeks of acupuncture in the carpal tunnel syndrome, the 3 digit is nicely separated, and that's what's recorded in that functional MRI. Next slide, please. So therefore, there's this promise with the implementing or complementing the treatment using this acupuncture and modalities offered by the traditional medicines with the carpal tunnel syndromes. And lastly, I would like to give a little bit of tips. How do we prevent the carpal tunnel syndrome? First of all, obviously, try to reduce any unnecessary overload or tense to your hands and pressure when typing, gripping, or holding the things. Give the proper amount and how you want to control the wrist and the tension of your muscles, and try to avoid unnecessary overload tense to that wrist, and give a lot of rest as well to the wrist and to the hand whenever we can, and do the tendon and nerve gliding exercise whenever we have a time for the break, and try to spend at least like about 10 minutes, 5 to 10 minutes in every hour to give exercise straight to the wrists, and keep alternate to use other wrists, and keep the wrists and the hands warm and loose, and wear the splint to keep the wrist straight or in the neutral positions, and try to improve the posture, because the overall body posture will also affect to the elbow and to the wrist. Next slide. So our university offer the program, complete program, 4-year program with the acupuncture and traditional medicines. We also have our own health center where we offer the treatment, this acupuncture treatment and herbal treatment, this traditional medicines treatment to our patients and local communities. These are sort of the activities that our interns and our professors did in our school. Next slide, please. And we also like the students also actually very involved as well, like in advocating these medicines, and also doing this free community service to the local community and providing this treatment. Next slides, please. And we also have various events that we involve with the various wellness events. Next slide, please. And our university is, obviously is funded by our foundations in the South Korea, which is actually very integrated between the traditional medicines and with the conventional medicines. Thank you very much for this opportunity to present this about this carpal tunnel syndrome, and hopefully all this information is very useful to all of us. And I'm happy to answer any questions if there's any. Thank you.
Thank you, Dr. Wong. We appreciate your time and energy and intelligence that you're sharing with us today.
Thank you
so much.
Appreciate it.
Raul, any comments, anything? Any questions from anyone in the audience today? And if not, we will close. You could always email us later, and we can answer some of your questions if you like. Okay. Take care, everyone. Have a great day, and thanks for being here. Cheers. Bye. Oh, yeah, let's do that. Okay. And how do I do that? Oh, yeah. Okay. Oh, here's I have to click on. Okay.
So while Patricia's working on that, we do have this recorded, so you guys can review it again, and we'll also have that takeaway PDF, which will also be able to answer some of the questions if anybody does have any after. So thank you, Patricia. Thank you, Dr. Wong. I appreciate it, and this is really helpful. Bye, everybody.
Bye.
Thank you.